What's going on, guys? Welcome back to the channel. I hope everyone is healthy and well today. Thank you so much for joining me. Today, we will be reacting to Canada's universal healthcare. So let's go ahead and jump right into this video. We're not wasting no time. Feel free to check out the Twitch in the description. Here we go, man. Yeah, I'm a little educated.
When you
I'm a
hear
little
people talk
educated
about
on
healthcare in
Canada
America,
healthcare.
there's one country that seems to get a good amount of attention.
Yeah.
It's a single-payer healthcare system, kind of like the Medicare for All plans that some well-known Democrats have been promoting. In fact, the system's unofficial name is also Medicare. It has universal coverage, it has relatively cheaper drug prices than the United States, and it also has reports of long waiting times and endless reams of red tape. You've probably guessed which country we're talking about. Canada. Canada's healthcare system is playing a larger role in America's political discourse as the 2020 presidential elections heat up. Progressives on the left love pointing to Canada as an equitable and efficient healthcare system. Conservatives, on the other hand, use Canada as an example when warning about the dangers of socialized medicine and unchecked bureaucracy. So, how different really is Canada's healthcare system from what's going on in the United States? In 2017, it's estimated that Canada spent around 10.4% of its GDP on healthcare. By comparison, the United States is estimated to have spent about 17.2% of its GDP that year. The OECD estimates that Canada spent around $4,500 USD per person in 2017. In the United States, though, the figure is expected to be at least double that, at $10,000 per person. Out-of-pocket spending is also lower in Canada. On average, Canadians spent around $650 USD per person in 2016. The average for Americans was around $1,100 that year. Canada still spends more than the average of all 36 OECD countries, which comes in around $3,800 per person and 8.8% of GDP. Despite spending less than the United States, Canada's Medicare system ensures citizens have universal coverage for medical needs that are deemed essential, something the U.S. hasn't accomplished. Canada also has comparable or better health outcomes than the U.S., even though it spends less money. But compared to other countries, Canada's healthcare system has room for improvement. Researchers looked at the rate of deaths that could have been prevented with proper access to care across 11 countries. Canada ranked 7th on the list, while America was last. We can see the same trends in infant mortality rates. Canada outperforms the US, but other countries like Sweden and Australia have much lower infant mortality rates than Canada. Canadians also live longer than Americans. Canada's average life expectancy is among the highest of all the countries and is nearly 4 years higher than the US. Additionally, Canada's maternal mortality rate is almost 4 times lower than that of the United States, and more Americans die of heart disease and stroke than Canadians.
That's because of the food. That's because of the food and everything that we're eating. Well, the fast foods and stuff like that. A lot of grease and stuff. You guys know. The chemicals are not the same. A lot of additives and stuff. A lot of sugars added within drinks and stuff. A lot of things are processed on a day-to-day basis. Majority of the people in the U.S. are eating processed foods, processed meals. If not fast food, fast prepped, fast prepared meals from out somewhere.
How does Canada manage to spend less money than the United States while having a more effective healthcare system? Canadian Medicare is a publicly funded model with private delivery. The system was established in order to ensure equity among citizens regardless of people's ability to pay. It was also created in order to keep administrative costs low.
There's no private plan can take cognizance of the family's ability to pay. Only a government can levy taxes on that basis.
All Canadians receive their health coverage through Medicare, which is run at the local level by each province under federal supervision.
So basically, the health ministry in the capital in Ottawa determines what procedures are going to be covered, what we're going to pay for it, what pills we're going to cover on our list. These are decisions that are made separately by insurance companies, basically in the United States.
That's T.R. Reid, author of the book, The Healing of America. He traveled the world exploring different healthcare systems and how well they worked.
In Canada, everybody has the same treatment. It would drive them nuts if George got better health care than Sam did. That's not acceptable in Canada.
There's some variation on what is covered based on province, but most medically necessary care is covered with no out-of-pocket costs. There are some universal exceptions. Prescription drugs are not considered essential under Medicare. Dental, mental health, and optometry are also not covered unless they are considered medically necessary. Because Medicare does not cover everything, most Canadians also buy private health insurance through their employers to supplement.
So therefore, if you're going for random checkups and stuff, all that pointless stuff like how people do on a regimen annually out here in the States. Oh, we gotta go to the dentist. Oh, is something wrong with your teeth? No, I just gotta go for my checkup. Oh, we gotta go to the doctors. Are you sick? Is something wrong? No, we're just going for our checkup. It don't make no sense, you know. It's really a waste of time. It's a waste of money. You gotta pay co-fees and stuff, even if it is accepted through your insurance. If it's fully covered, you gotta pay co-fees. You can't opt out of that. It's so useless. But if it's a need now, you know, this is where it's different from us. If it's an actual need, you guys, it's fully covered apparently. You know, you don't have to pay out of pocket this and that. Depends what it is. Out here, it doesn't matter. We gotta pay. We don't. Oh, sucks. Can't perform this surgery on you unless you have about 60,000 up front. Mind you, this surgery is about 100, 200K. And mind you, you have 73 hours to live. Like, bro, they do stuff like that. Some bull crap you'll see on a TV show or something. Yeah, and mind you, you have 72 hours to live. And you don't even know where to come up with this money. Like, it's people sitting there hopeless in hospitals, bro, just waiting it out. Are you serious, bro? We gotta change something. Like, what's up?
For everything. Most Canadians also buy private health insurance through their employers to supplement out-of-pocket expenses. They cannot, however, use that private insurance to purchase care that is covered under the government plan.
If there's any treatment or procedure or surgery that the system covers under its rules, then you can't buy it privately. This is because, you know how in America we hate this notion of socialized medicine, whatever it means, that's really bad. In Canada, the bad thing is what they call two-tier medicine. That is, they don't want rich people getting better care than poor people. That would be terrible. That would violate their basic egalitarian values. In America, we kind of take it for granted that a rich kid is going to get better treatment than a poor kid.
Oh, we know that. Oh, we don't take that for granted. I know that. Oh, I already know that. Oh, yeah, I know. But see, the thing is, people got to understand the U.S., all the rich people, they get benefits, you know, they get treated well. They get free things, complimentary. It don't make no sense, but they're rich. But you're going to charge us, though, minimum wage, you know, medium wage, and even the people that are like down below medium wage, you're going to charge us, though. But if you're a celebrity or if you're just rich, it's good business to keep you as a friend, I guess. So they get things for free. Maybe in hoping of a next time, you know, maybe there's a next time they come for business, stuff like that. It doesn't make sense, guys. Out there in Canada, it makes sense, you know. The rich don't, you know, why are we making sure that they got the best health? Everybody else, you know, needs to be taken care of as well. And the rich people, should I say, they have money to have access to exclusive, should I say, medicines, or they have enough money to get access to a medicine or maybe some type of privilege or something with their bucks to be able to get something right away versus the average person. You see what I'm saying? It's more of a privilege. Money speaks, God, and this is every country. Money speaks. Oh, believe that. You don't even need to be a celebrity most of the time. It's money. Money speaks. Hit them with that price. You can make it happen.
America, we kind of take it for granted that a rich kid is going to get better treatment than a poor kid. That's kind of standard. In Canada, that would be taboo. That's a sin.
In 2015, private funding such as household out-of-pocket costs and private insurance spending accounted for about 30% of healthcare spending in Canada. Despite the majority of healthcare being publicly funded, most hospitals and doctors' offices are privately owned and operated. Doctors who own their own private practices are considered contractors who bill the government insurance fund for their services. The government is not their boss.
The doctors are not allowed to practice outside of the system. They can either practice completely in the government Medicare system or completely out of it. And there are very few places in Canada where a doctor can make a living without taking the Medicare patients. And therefore, for most people, it's the only choice.
I
Despite
used
having
to have a private doctor. I went to New York as a kid, and the office was literally, literally on a block with homes and everything, and we was right up in his house, and it was nice. It was his house, but just walked to the back, and it was his dentist office. Like it was crazy. He had a desk up there and everything with an assistant. I'm like, this is your home, but by day it's a dental office. It's a dental slash doctor's office. Excuse me. He was like trained in both. It's crazy. Like he was certified in both. That man probably making a bag. But yeah, it was an older guy. It was an older guy. But I mean, we was right in his house with it. That was a private care. Yeah, things were a lot cheaper to get my shots and stuff. As a baby, not realizing that, it was like, oh, I gonna get my shots. Can I get McDonald's after? Yeah. But realizing as a kid, it was like we was going there instead of like the doctor's office that people go to now that my sister goes to and stuff. It's like those are family offices and stuff. Like you see families in there. This is private. It's just us in there. So it was really different. It was like it must have been cheaper. You get to realize that as an adult, why certain things happened as a kid, why they were taking you here instead of here, and this and that. And he was great. He was amazing. I hated getting my shots though. Couldn't tell me nothing. As long as I'm getting that Mickey D's after, boy.
And therefore, for most people, it's the only choice.
Despite having universal coverage, the system still has some problems. Wait times are longer in Canada than the United States. In a 2016 survey, 53% of Canadians said they were not able to get an appointment on the same or next day when they were sick or needed attention.
That is an issue out there in Canada that I'm aware of. The wait times. This is everywhere. It's the wait times. Oh my goodness. How can we reduce it? We don't know. There's a lot of people on Earth.
To get an appointment on the same or next day when they were sick or needed attention. The United States performed slightly better at 42%. Out of all of the 11 countries surveyed, Canada performed the worst in that category. 30% of Canadians said they would
Canada performed worse probably because, wait, you said America performed better? That's probably
get an
because
appointment on the same or next day when they were sick or needed attention. The United States performed slightly better at 42%.
Yeah, it's probably because you're dealing with ignorant people. I've seen it a billion times in the hospital. Every single time. Doctors every single time in the hospital. Every single time. Every single time. Well, I'm about to be in labor, or I need this, I'm in pain. Everybody is in pain. Everybody needs help. But we got somebody going crazy, rambunctious. We got this person about to fight. We got this person about to punch a hole in the wall. Punch one of the nurses. Shatter the window to break the door off the track. Like it get crazy. And then it's like, can we just get them to here? You get to rushing people, Get to trying to just find something, make something work. And then you put these poor people, the staff, under pressure. And it's rambunctious. You guys are a lot nicer. So you all are going to sit there patiently and wait in pain. I would do it too. I would do it too. People out here don't care though. They don't care about nobody else around them. It'd be a knifing homeboy back behind you. They don't care. As long as that knee hurting. I gotta go down. I'm bad. But you don't care about nobody else around. That's how it is out here. It's one for all in the U.S.
Of all of the 11 the United States performed slightly better at 42%. Out of all of the 11 countries surveyed, Canada performed the worst in that category. 30% of Canadians said they waited 2 months or longer to see a specialist, compared to 6% in the United States. Nearly 1 in 5 Canadians waited 4 months or more for elective surgery, while only 4% of American respondents said the same. About 60% of Canadians find it difficult to access medical care in the evenings, on weekends, or during holidays without going to a hospital. These long wait times can lead to the overuse of the emergency room, where half of Canadians said they've waited 2 hours or more to be seen.
It's a good system, but it doesn't work that well in Canada, interestingly. In its own home country, there are long waiting lines. There are constant stories about care being denied, or people just had to wait months just to see the doctor. And I believe that's because the Canadians are too cheap about it. They just don't spend enough on healthcare to have a lively system. Some provinces, like Saskatchewan, where
Wait a minute, but we spending $1. We spending a buck, and it's still the same way. And it's still the same way. Ain't no privilege no matter how much you spend. It's just too much people. It's too much people. We need like a super hospital, a massive one. Massive hospital. I'm talking about super hospitals. But we need more doctors and nurses. Not more. I'm sorry. Everybody can't be no social media influencer. You know? What's meant for you is meant for you as well. But everybody can't do it. We got people just trying to tag along and follow just because they think it's an easy way out. Stick to your plan and what you was called to do. Okay? Stop trying to take it the easy route because it's not going to work that way for the people that wanted it their whole life. So pursue something that you truly want, makes you happy. We need doctors and nurses and this and that. Or we can't have them massive, big hospitals. I'm talking about big, like factories, warehouse facilities type of big. We could bring them all in. But we need a lot of people, and we'll probably have to pay a lot of people to come out of the country. And seeing how my country is right now, we're not paying nobody from out of country to come in our country to help out our country. So it's like, what are we gonna do? You know what I'm saying? So I think it's just too much people. Too much people.
This started to have a lively system. Some provinces, like Saskatchewan, where this started, have shorter waiting times for both acute and elective treatment than most of the United States. So there are parts of Canada where it works.
Not all medical care is covered in Canada,
Say not all
which leads
parts.
people to have significant out-of-pocket costs. Medicare does not classify
Some parts are smaller, less population, so the wait times. This and that, I'm aware of that, but majority of the time we go up in there, we know we gotta wait.
prescription drugs as essential, which means they are not covered for many patients. There are some social programs to help Canadians pay for drugs, but the benefits vary by province. For example, Ontario provides prescription drug coverage for anyone under 24 years old who does not have private insurance. The province also has a drug program for people 65 and older. Canadian pharmaceutical costs are also not as controlled as other countries. Canada spends approximately the same amount as the UK on pharmaceuticals, despite having only half the population. There are also no out-of-pocket caps on spending. In 2015, Canadians spent around $670 per capita on retail prescription drugs, compared to the United States per capita costs of roughly $1,000. In 2016, 1 in 10 Canadians did not fill a prescription or chose to skip a dose due to cost. This is still significantly better than the United States, where nearly 1 in 5 people chose not to buy medication because of cost.
Dose. We got people savoring their doses because, let's not take it today. We can take it tomorrow, so we save some. No. That dose say take it. That dose say take it every single day into this time. Don't be doing, bro. Like, it's what we all got to go through around the world. The healthcare is way better than ours in a lot of countries, including yours. But I'm pretty sure there's a problem in every country that could be fixed. Everyone has problems. Everybody has issues within their healthcare, just their country that could be fixed. But it just seems that it's not as bad as the U.S. You could hear or speak about something or see something bad or going wrong in one country, but to hear about it in the U.S. is 10 times worse.
Despite the problems, Canadians are proud of their healthcare system, but they do recognize it needs reform. 94% of Canadians surveyed said it was an important source of both personal and collective pride. But nearly 1 in 4 Canadians were concerned about whether they would be able to pay for all of the care they might need if they ever became seriously ill. Despite that concern, 45% of Canadians rated the overall quality of medical care in Canada as excellent or very good, and nearly 3/4 said the same of their personal care in the past year.
The citizens are crazy about it. It's egalitarian. It treats everybody the same. That's the most important societal value in Canada, is treating everybody equally. And the other thing they like about it is they know it's better than the U.S. system. They have better outcomes. They have better recovery rates from disease. They have longer life expectancy, and they pay less. And man, they love being better than the U.S. That matters to Canadians.
You're trying to rub it in. You try to rub it in the last few seconds of the video. I get it. But seriously, man, I mean, it works. It's a system that works, but at the same time, it could work a little better because there's still wait times out there. Gotta think of a way to get around that. It's gonna be a little difficult, but I'm pretty sure your PM will definitely think of a way over the time because he's great at coming up with ideas and solutions to the issues of Canada. Ways that could benefit everyone, not just benefit the government. And that's really good about your country as well. Everyone gets treated the same. I've heard so many stories of people like in a hospital get told, "I'm sorry, ma'am or sir, your healthcare provider doesn't fully cover this, or we won't be able to accept or give you this because your healthcare provider doesn't do this." Then you gotta go through another place or call them and see if they can like make it happen or something like. And I just be like, "Oh my, well, okay, well, how much is it out of pocket?" Because now they got a big line behind them and they nervous. 400 or 500. What? Well, you might as well let me lay on the ground. You know what I'm saying? Everybody, stay safe. Feel free to share honest thoughts and opinions down below in the comment section. Feel free to check out the Twitch down below in the description. I hope you all stay safe, and I hope to catch you all in the next one.